Hello, welcome to the Mindfulness for Dental Hygienists. I was thinking about the last time I did a webinar or a video for dental hygiene community was during COVID when I did the diagnosis, the perio diagnosis, and then also I did one on sharpening. And so it's about time I come back and say hello to my dental hygienist friends. And I appreciate you joining me tonight. Now, I know it doesn't matter when you're watching this because I'm going to record it and add it to my YouTube channel. But I just want to put this little caveat out there just in case. So I am literally on the top of a mountain in Utah, and the storm is swirling around me. So not that that will matter to you. I think we've got great sound. It's not going to be a problem. But if the power is to go out, that could be a problem. So I'm just going to put that out there. I hope you're doing well. I hope we all have gotten through the worst of the COVID. Unless you're in China, then hopefully you're doing well. I'm going to go right into it and share my screen. And we'll get right into this. Of course, it's going to be right where I need it to be. I love that. Okay. If I put myself a little bit out of the way. Okay. So, mindfulness for the dental hygienist. And let's go. So just in case you don't know who I am, my name is Kathleen Allen. I am a dental hygienist and also a certified life coach. I practice dental hygiene for, if I add up the different times I did clinical here and then there, over 20 years clinical. And I've also been in marketing for a dental hygiene online app for students preparing to take the NBDHE. I helped compile questions for that website and also marketed for a year with them. That was really fun. It's called Hygienist Prep. And then also, if you haven't heard of it, it's because they only had me marketed for 1 year. So I'm just putting that out there. Anyway, then also I've worked at the dental school at Rosemond Dental. Oh my gosh, has it been so long that I forgot how they say their name? Rosemond School of Dentistry. Anyway, it's in South Jordan, Utah. And I had a good time over 3 years teaching dental students how to clean teeth. And that was a fun time. So that is the reason why I even put together the previous, if you go to my YouTube channel, you can see for the perio diagnosis, because I had to teach dental students that didn't know how to use a probe how to do that diagnosis, because the periodontists that worked at our school wanted them to learn this latest diagnosis. So I figured if I was able to make it simple enough for a dental student, then I could also share it with dental hygienists. So anyway, that's that. And so I worked at the dental school like 2017 through just like a year ago when I decided to put my full time into my coaching business. So that's what I'm doing right now. All right. So why mindfulness? And hopefully my glasses won't make you crazy with the light now that I'm just small, but it will help me see. So Oxford Dictionary, a mental state achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one's feelings, thoughts, and bodily sensations, used as a therapeutic technique. So the reason I used the title Mindfulness for Dental Hygienists is because I really think that what I have learned is it is so important for us to have a sense of awareness of what's going on in our thoughts and our feelings as we are working. And I think it's interesting, the whole bodily sensations, because that's what some of us really do. I feel like I did struggle with just how difficult dental hygiene is on your body, and important to pay attention to that and what your body's telling you. So a few quotes for you. William Shakespeare, there's nothing neither good nor bad, but thinking makes it so. Just that if we hear something that sounds terrible, there was a terrible car crash, okay, out on the mountain because of the storm. The crash wasn't terrible. The crash just happened, but it was my thinking about the crash. It was my thinking about those poor people being out in the cold and what happened to their car and all that. So it's our thoughts that actually decide if something is terrible or not. And then James Allen, as a man thinketh, into your hands will be placed the exact results of your own thoughts. You will receive that which you earn, no more, no less. So this to me tells us why it is so important that we're aware of our thoughts, because our thoughts are going to bring our results. So if we're not happy with the results in our life, we really need to look back at where our thoughts have been and what thoughts have gotten us the results that we don't necessarily want, and vice versa. If we really, really like certain results we're getting, we really should examine the thoughts that helped create those results. All right, Wayne Dyer, I cannot always control what goes on the outside, but I can always control what goes on the inside. Now, this is a really good one for, I felt like when COVID hit in the dental schools, and I mean, we closed for a while, like probably most of you didn't work for a while, but then coming back and the armamentarium that they made us put on, oh my gosh, I mean, we went to face shields, which you probably did too. They made us have 2 masks. So we had the N95 mask and another mask over the top so that we would change it out between, because we would go from different patient situations as we were checking on the students. And we also had a gown that was disposable that we were supposed to change between ops. And so anyway, it was crazy. And I remember when the dental let's see, one of the professors came up and was explaining to us, all the hygienists were in our office, and she was showing us what we had to do, what we had to wear, how we had to, we hang our coat here, we do this. And I just remember, okay, I got to figure out how to get into my head that this is all going to be okay, because it just looked like there's no way this is going to work. But I started thinking things like, I know in 6 months, this is all going to be like normal and we're going to figure out a way and all of this, but I'm kind of getting ahead of myself. So anyway, just my point was that COVID was an experience that was outside of our control, but what we could control is how we dealt with it. So I'm sure everyone's probably thought that. So I want to teach you briefly. The school that I went to, you know what? I blew these up so big. Maybe I don't even need my glasses. And that reflection is just making me crazy when I look at it. So I would think it might bother you. But so the life coach school that I went to is called the Life Coach School. I don't know if you've ever heard of Bert Castillo. If you haven't, you probably are not on social media that much. She is all over it these days. But I went to school back in 2019 is when I heard about her, and I started in the class in 2020, like right as COVID was hitting. Anyway, the thing that she uses the most is the tool she uses is the model. And I can teach it to you because I'm certified to do so. So it's not a big deal. And she's the first one to say she didn't make this stuff up. She just brought it together, a bunch of truths that have been out there. So the idea is they call it the CTFAR. So sometimes you'll see it abbreviated like that. The C is the circumstance. So that would be a factual situation. So something that could not be argued. So it could be proven in the state of law. So for example, if I was coaching someone on fat loss, they couldn't say to me, their circumstances is I'm fat. No, they would have to say, I weigh X number of pounds. That is a fact. Okay. So it's the factual situation. So it could be COVID, like for my last example, it could be COVID, dental school closes due to COVID or something like that. So the thought is then what you think about the situation. So really important, because it's your thought that determines what you're labeling that situation, if it's a good or a bad or a neutral or whatever. So it is your thought that causes your feeling. So when you say, or when I said, I don't know how we're going to wear all this stuff, then I might feel kind of like dismayed or frustrated, probably not as strong as frustrated, but just kind of like doubtful maybe that this is really going to work. And then the action that I would take would be, I'd keep looking for evidence. Probably if I was doubting, I would keep looking and thinking, yep, see, that's going to be too hard to do. There's no way that I could change that in between. How many gloves am I going to go through? I mean, so I just kind of, your actions follow whatever feeling you're having. And then your result is what happens due to your thoughts. So if I'm thinking, how are we going to do this? There's no way we can do this. Then guess what? I don't find a way to make it work. So let me give you an example that might be a little bit closer to your home. So there was one day that I was called to temp. I do temping now and then. And I was scheduled with 28 patients on that day. Now, I don't know if this is a record. Probably some of you out there have done more. This was a record for me. I was like, are you kidding me? I'm the only hygienist? Yes, you are. And I'm seeing 28 patients. Yes, you are. Okay, so the thought was, what the heck? I should walk out right now. I mean, I just threw my head. I was like, I can't do this. This is no way. Nobody should be able to, no one should be asked to do this. And I really had some strong resistance. I knew that this was a big practice. So there were other doctors in there. So I looked for other hygienists, like saying, are you freaking kidding me? Do you do this? Did you see my schedule? Is this what you do? And then I asked the assistants, I was like, is this normal? I mean, really, is this how is this supposed to work? And I looked for all the reasons that the schedule was ridiculous and unworkable. And I looked at like their instruments. Oh my gosh. I try not to talk negative about offices that I'm in, but this is one of the few offices that I've seen that there were loose instruments. The instruments that I was to use were in the drawer in the operatory. Anyway. So the result of me saying I should walk out now and all my feelings and all those was I was walking away from the challenge, right? And I'm telling you, the only reason I didn't is because I started thinking about the temp agency and I actually had made a commitment to them that I would be there. So that's whether I was right or wrong, the professional part of me thought I owe it to the temp agency to complete my day. So here's an intentional model. Here's what I jumped to. Okay. And this was actually before I went to, I think it was before I'd done my coaching training, maybe. Yeah. Anyway, so I thought I can get through this day giving my best to the patients, coworkers, and myself. So I just kind of did this mind shift like, okay, what's going to be my best? How can I deliver my best on this day? And my feeling there was when I was resolved. I was going to figure out, obviously my best at that office wasn't going to look the same at a different office when I didn't have the same structure. But in this particular situation, and I started sharpening instruments. Like if you've watched my videos, you know how passionate I am about sharpening. And I just started going down. These instruments were, wow, they hadn't seen an edge forever. And I will say, kind of funny, but the dentist came in and said, what are you doing? And I said, I'm sharpening the instruments. And he said, there's going to be a lot of people upset with you. And I said, are you kidding me? There's going to be a lot of people so happy that I found an edge on these old instruments. So anyway, that was maybe a little bit snarky, but I couldn't believe that he was like telling me I shouldn't be sharpening the instruments. But anyway, I got as many sharpened as I could. And I talked to the assistants. I talked to them about how I'm going to probe everyone. And if I'm seeing a lot of 5s or 6s or, then I'm going to call you in and we're going to hurry quickly probe. And I'm going to scale because that's what I need to do. But I'm going to expect you to give oral hygiene aids. And I'll tell you if there's, show me where your proxy brushes are, show me what you have so I know what we can talk to the patient about. And I will tell you before you come in to polish and I go to the next patient, I will tell you what to go over with them. Are we good with that? Because it's really important to me that the patient leaves my operatory knowing more than they did when they came in. So I'm going to pass it to you and you're going to pass it to them if I haven't had time. So anyway, there's just all these things. And I also said, if there's a patient that needs something more than a prophy, then we're going to have to reschedule them. We'll do a full perio workup, but we're not doing SRPs today because there's no room in my schedule. So I kind of set up a boundary of what I would and wouldn't do. And I will say at the end of that day, I felt like I gave those patients the best I could. And the assistants worked really great with me. And I did have to say I had to pull the dentist aside one time and just say, I have this one patient. he really needs to have SRP. I don't have time in my schedule today. We're getting the workup. And he was actually supportive of that. So I felt like that was a way to take a day that could have just been awful. Like if I hadn't sharpened the instruments, if I hadn't set myself up with the assistants, I think I would have just been like resentful the whole time that I was, what am I, just a scaling machine? All these things would have gone around in my head, but instead I took control of it. And that's the reason I love the model is it takes a situation where you normally would think, I have totally lost control here. And you figure out what you do have control of. And what you do have control of is right up here. It's your thoughts about the situation. As soon as you get a hold of your thoughts, then you can control what you feel and what you do. Okay. So this is a little bit, I tried to bring it down to a situation, but I realize that talking in this model language is a little bit out there. It's a little bit coachy. So let's get a little bit more taking each section of this model into real life. So thoughts or beliefs as far as the dental situation goes. So the things that you think could be also beliefs, right? This is a post that I did a while back. Just so I know some people kind of resist the idea that dental hygienists have to get patient acceptance, but let's be real, we do. I mean, we talk, whether it's getting them to do the perio treatment that they need, whether it's for them to understand that we're just going to do a scaling in the presence of inflammation, and we're going to bring you back in 6 weeks and do a regular cleaning and check to see if our scaling took care of the inflammation. So whether it's just getting them on board with that, whether it's just getting them on board with patient education and using the tools that you know that they need to in their mouth. So I think we're all about getting patient acceptance. So here's the difference between a hygienist who believes the patient will accept treatment or a patient will not accept treatment. And I actually wrote this thinking about a dental office that I had worked in San Diego. And I don't know. I came into the practice. There were a lot of patients. The hygienist had been there. She was a great hygienist, but she had been there for a long time. And there were a lot of patients that she believed would not accept perio treatment. So she just continued to see them every 6 months and tell them that their periodontal health was declining, but she knew that they wouldn't do SRP. Well, I got him in my chair and I don't know. I educated them in a way that they always came out to the receptionist and they scheduled their SRP. And the receptionist said to me, "Why is that your patients always accept the SRPs or always accept whatever treatment is that you're saying they need?" And I started thinking about it. And of course, looking back, it's because I believed they would. I honestly believe that my patients, if I explain it to them like I see it, they are going to accept it. And I come to them with really positive energy about it. And if you're thinking that way, then you're going to value the time to educate them. Because to me, an educated patient is a compliant patient. That's what I always told my dental students. You take the time to educate them and they will go through with the treatment if they just understand why. And you treat the patient as someone who cares about their dental health. So you just assume that they care about their teeth. And then you're prepared to talk to them about their objections because you understand. And so you've thought about, well, if they think it's too expensive, then you compare it to other things like, well, it's not going to cost near as much as a car repair, and you're going to use your teeth way longer than you're going to use that car, whatever it takes, whatever you can think. But anyway, if you don't believe the patient will accept treatment, if the patient comes in your operatory and you're like, gosh, they're going to tell me no, they always tell me no, you're going to be negative. You're going to not even educate them. It just isn't worth your time. You're going to be a little bit condescending and you're going to shy away from talking about their objections because you're going to think, what's the point? I almost always was able to connect with a patient. Once I found out what they either like to do or their occupation, I would liken what I was doing perio-wise or what the dentist needed to do to something that they would understand in their lingo. anyway, we'll get onto that. But so this is just an idea of why your thoughts matter, because they really do guide your energy, they guide your actions with your patients. So what you're thinking about the patient is very important. Okay, so let's talk about the feelings part of the model. So I would say the feeling is also your energy. So what kind of energy are you bringing when you step into your operatory? So here, I'm going to talk to you a little bit about external factors in operatory and internal factors. And my little picture's not showing up. I had a picture of me with I was cleaning my son's teeth, whatever. Anyway, thank you, tech. I love tech. But okay, so I'll take these off again for a second. So operatory energy, the external is, so it's kind of like what determines the energy in your operatory. So it might be the expressed or unexpressed fear of the patient. It might be the music playing in the operatory. That kind of sets a tone. It might be the physical atmosphere, whether it's like, oh, maybe that's why my picture's not up, because I was going to use an example. It was a little bit messy and cluttery. And yeah, anyway, so conversation between staff members, like if there's two people talking back and forth, and that is establishing an energy, whether they're talking and it's fun and they're involving the patient, that's one kind of energy, or whether they're kind of griping about something, that's another kind of energy. So sometimes if there's a clock right there for me and I'm behind, that's going to bring up a little bit of energy for me. And then the particular procedure, maybe I'm doing perioproby. Maybe I'm doing scaling, and we're really hoping to be able to get these 7 and 8 millimeter pockets into the 5 and 6 range. So it's where I really am comfortable keeping this patient in my practice. And so maybe it is a little bit more complicated. And so there's a little bit of, energy there. The smells in the office, to some patients, that's like horrible. So you could think about that. That could be energy. And the temperature, depending on how old you are, I know sometimes I've had to do like the whole fan in the face. And I'm not saying that the external factors are things that you shouldn't do anything about, because if you can control them, go for it, and it's just something to consider. But the things that you can control are those internal things, the thoughts that you're having, the feelings, what you say to the patient, how you respond to them, even your breathing. Like, I don't know, there's sometimes that I just take a deep breath, and like, those patients that are just like got their mouth like this and you can barely get your fingers in there. Sometimes I would just laugh, or I'd take a deep breath, and just to get them to relax, and the tone that you have with them. And so the example I want to give here is when I was in the dental school, and of course, bless dental students' hearts. I love them. I love them so much. So it was the practitioner was a guy, but the other dental student that was assisting was a woman. It was a young girl that we're doing extractions on, and she was so stressed out. She was just like, and I can't remember who was with her, but it was I think it was a male friend, and he was worried too and knew how worried she was. And I walked into that operatory and I just grabbed the dental student and I said, come here. And I said, you need to determine the energy in this operatory, not your patient's fear. I said, you know how to do this. This patient right here wants to know that they can believe in you. And the way that you let them know that they can believe in you is you go in there with confidence, with authority. You tell her what you're going to do. You tell her how it's going to feel, and you tell her she's going to be okay. But she's got to hold still. She's got to open your mouth, and she's got to let you do what you know how to do. And it's just, for him, it was just like, oh, yeah, okay. But I do believe that we can I've taken a patient that was so nervous like that and had them fall asleep in my chair when I was doing SRPs. And it's only because I started talking to her softly. I explained everything I was going to do. I said, don't worry, I'll take care of you. I tap her on the arm. So there's a way for you to go over and have your energy be driving what's happening in that operatory. So that's kind of the feeling part of the model. So here's a way, like, if you're right in the middle of something and you know this is not good energy and I need to change it. So here's what you can do, like right on the spot. Name the feeling you're having. If it's like I'm anxious, I am overwhelmed, whatever it is, as soon as you name it, even if it's in your head, it starts to lose its grip on you because it's kind of lost a little bit of power because it's like, I see you overwhelmed, I see you anxiety. And then consider what thought you had that caused you to feel this way. Now, I want you to stop right there is because maybe it's a situation that you should be anxious in. Maybe your patient just passed out and you're anxious, and yeah, you sure as heck should be because you need the energy to go get somebody to call 911, and you'll still, keep yourself under control. But sometimes it's completely appropriate to have certain thoughts, but often the thoughts that you'll have are not helpful or essential thoughts. So you can let them go. So then you think about, how do you want to feel? And this one, I think you can think about ahead of time. Like, what do you generally want to feel when you're in your operatory? You can choose whatever word you want. You can have it be calm. You can have it be in control. You can have it, I kind of think I would like it to be confident, competent for sure. So anyway, just think what kind of a feeling you want, and then consider what thought you would need to be able to access the feelings that you want. And I'll let you see what this looks like. So if you are feeling tense, your thought might be, I'm behind and this patient is really anxious. Okay. What I want to feel is in control. I want to feel confident. I want to feel resolved. So my new thought could be, I've totally got this. I know exactly what needs to happen here. I was born for this kind of work. My patients eventually all love me. So you can borrow one of those if it works for you. But especially if I was behind, I honestly think I would tell the patient, it's better to me if you just out with it. And whether it's your fault or their fault, you can just say, these are, I'm going to give you the care. I remember a time back to that San Diego office, because I was getting all of her perio patients, I was regularly behind. And I remember pulling the patient back. I wouldn't get really far behind, but maybe like 10 minutes. And I remember bringing the patient back and saying, I'm sorry you had to wait. And I will tell you that I will spend the allotted amount of time for you too. And I've had the receptionist call our next patient. So I don't want you to feel like I'm not going to take care of you. So, I mean, anytime that you think the patient might be questioning your competency is a really time to educate them and to get on board with them. Even if you have to get vulnerable, it's really important that you keep that trust with them. Okay, now let's go to actions or inactions. So in the model, you list the things you do or you don't do because of the feeling that you're having. And what I wanted to do about this one was I wanted to talk to you about just different actions or things that I do to be able to have the feelings that I want to at work and with my patients. So the circumstance is a patient and a hygienist in an operatory. My thought is, I'm going to offer the best care for my patient. That is generally my thought. I just always want to try to give them the very best care that I can think of. I want to feel generous that I'm giving to this patient. I want to feel resolved that I'm going to do it, because sometimes the patient gives you a little bit of if they don't want what's the best thing for them. I'm feeling committed or confident. So any of those feelings would work. So then now we're going to talk about, what do you do or don't do when you feel these kind of feelings. And because I was thinking that I'm going to provide the best care and having that positive feeling, I'm actually going to provide the best care. So here's what that looks like for me. This was another post that I did. I was asked to write an article for a publication on different ways to connect with the dental patient. And so I came up with these 12 ways, and you can come up with your own. I mean, use these if you want, but whatever works for you. So my first thing is, introduce yourself and explain your scheduled appointment plan. Get permission from your patient before proceeding. So it's just understand what we're going, and it doesn't take long to get that. It's just basic, and everyone probably does this. Take down and set up at each operatory as if you were doing so for a loved one, because you are. So I like this because I like this thought because hello, Amazon, thank you. Um, because I've watched people set up and take down an op and so fast and like, I don't know. I just think if I think in my head, someone I really care about is coming in next, I'm going to do it really carefully and I'm going to make sure I do a really good job. Okay, next is find a way to relate with every patient, no matter their age, gender, race, whatever. And this is so good. Um, I really do think that no matter who it is in your chair, you can connect with them. Whether it's you start talking to them about their tattoos, whether you talk to them about school and you find out that they hate it. And so then you find out, well, what do you like to do? You know how to do this. But anyway, find a way to connect. Personalize your approach for every patient, your tone, energy, amount of talking. You know how that goes. You start talking to someone and you realize this person does not want to talk to me at all. And so you just don't talk much. And then again, let your energy direct the mood in the operatory, not them. Commit that every patient who loses your chair, I alluded to this, but I like to think that they're going to know more about their mouth and their oral health than they did before they came to my chair. Even if it's somebody I've seen 6 months ago, I'll just always try to point out something. Oh, that one pocket we were noticing, I feel like it's changed a little bit. Or, this time I feel like there's plaque here and you were doing better here. So I always try to find one thing. Educate before selling. That was another one that's kind of stickler. People don't want to think that hygienists sell, but let's be real, we do. So I think before you're trying to sell them on the idea that they need something, take time to educate to the why. Respect everyone in the room, your assistant, your patient, other office personnel, the doctor. I know sometimes it's like a popular thing for hygienists to like kind of bad talk on their doc, and I'm not a big proponent of that. I mean, maybe it's because my dad was a dentist. I have a brother that's a dentist. I have a great respect for the dental profession, and I feel like I'm part of the dental profession, and I feel like the boss that I'm working for, the employer, um, I've worked for some that I personally didn't maybe, um, didn't want to hang out or go on vacation with, but I respected them for the professional that they were, and they in turn respected me also. So show up always at your best. I believe, I mean, I know that it's the Brene Brown thing to be vulnerable with people. And I think you can, to a certain extent, be that and you can be yourself. But I think it's really important in our role to leave your personal stuff at home. I worked with a hygienist one time that she would tell all of her personal stuff to her patients. And I felt so bad for them. It just didn't seem to me from how they were responding that they were enjoying themselves so much. But so that's my feeling. If you find something that you have in common and you feel like it would be helpful to this person to connect on a really personal level, that's fine. And I've done plenty of that. But as a rule, I keep things at home. I have an employer say to me, I don't know what's your job. The interesting, it was really a compliment. It was like a performance review because he didn't know, but I was going through one of the most like struggles I had ever had when I was working for him, and he didn't know it, and that was the way I wanted it. And so, anyway, I think if it would have been a different office that I'd worked in, and I felt differently about him, I would have shared, but I hadn't felt that, so I was pretty happy about that. Anyway, keep your instruments, technique, and materials sharp and up to date. So important. Sharpen those instruments and just stay up to date with continuing ed and all of that. Do your best work. If you're not able to, honestly explain the circumstance to the patient. So I have had situations where for whatever reason, the position of that tooth, I cannot get to the distal of that tooth, the angulation. And I tell the patient, I'm not able to get down. I think I've gotten enough calculus and plaque out of here that we're going to get a good response. If we don't, we may have to send you to a specialist and they may need to lay a flap or do some kind of a bone graft or something there because it's really hard to clean the way this is. I just think it's so smart to keep them informed of what's going on in their mouth. And if it's keeping you from doing the job, then they need to know, I think. And there you go to if stay in integrity with your work. If the patient would be better served elsewhere, refer. And I really believe that's true. If you think that the periodontist office would serve your patient better, then that's where they should be. Okay, enough of that. So let's now talk about results or outcomes. So I know that sometimes we think about work and we think, well, that was a good office because I was making X number of dollars. And I'm not saying there's anything wrong with that, because heavens knows I've loved working in offices where I feel like they really have give me an excellent compensation package. And I've anyway, and then there's always the how much your production or the case acceptance. And I think that there's also you get positive results from just your job satisfaction. I mean, who doesn't love cleaning off that bridge of tartar and have it just be so clean and have the gum tissue just shrink up and you see them back the next time and they're doing what they're supposed to be, and that is wonderful results. But when I've had to, like, especially when I've been in job interviews and someone has said, what do you really like most about your job as a dental hygienist? I have to say that the thing that I love the most and it brought me the most meaningful results is the way that I connect with my patients, with the staff, with the doctor, anyone. It's the personal connections that really matter to me. So I'm going to talk to you just a little bit about that, about how this mindfulness can apply, like being aware of your thoughts and your feelings and how this can apply to getting along. These are two of my cute dental students. And they thought they were my favorites. So we'll just not tell them any other thing. But anyway, so this is just we all have had coworkers that we didn't maybe get along so great with. And so I have two ways for you to improve your working relationships. First is to find a way to connect, talk to them about life outside of work, try to imagine what challenges their job presents and ask them about it. This is a good thing because so often we are in our own world and we think that the way that they're treating us is how they feel about us. But oh my gosh, could I just tell you, and you've probably experienced this, it's all about how they feel about them. That's how they're responding to you. I do think when they put you down or question you, ask yourself if there's any truth to what they're saying. What could you learn from them? Almost always there is something. And that is, I put the big arrow because that really is true. It's hard to hear sometimes when people are critical of you. But really, some of the best learning that I've had is from people I don't necessarily like, but just trying to think, could any of that be true? Do I sometimes act like that? Maybe they're right. It just helps me. Even if I don't think they're right, but if I just get really curious about it, it helps me to just get into their head. And then there's always the for fun. This helped me. Another office in North County in San Diego that it just was not a very great environment. And I would go out for a walk at lunch and it just filled me again. I felt so much better. Sometimes one of the assistants would go with me. So, and then the other thing is, but look for a way to help them with their responsibilities, whether you offer to, I made a collection phone call when collection calls in an office that I worked at, because I don't know why, but she was so nervous to make this phone call. And I said, what do they owe? She told me. I said, give me the phone. And she couldn't believe it, but it was just like, probably just because I had no skin in the game. I didn't have anything to lose. She was worried that I don't know. I think she was more worried about what the patient was going to think of her. And I was like, they owe us money, right? Okay. Anyway, but so that was just all to say, look for ways to help. And obviously, I feel like right now, at least when I go in and temp, and maybe it's because I am temping, I do so well if I keep up on my own like instruments, and sometimes I can't even do that. But if I can take my x-rays and I can get my notes in, and I feel like I have no other time. But I know the more I'm in offices, I do have time. A patient cancels or whatever, I always try to find ways to help the other staff members. So the second thing is really figure out the problem and it's not them. So I know that it's not what they say or do that's difficult for you. It's your thinking about what they're doing or saying that's the problem. So, for example, I did have, like I've had a receptionist say, you need to be on time. You are getting behind. Like that, when I said that one practice, I was like 10 minutes behind. You're always behind. The patients don't like it. We really want you to be on time. And it was, so I would feel bad and I would think, oh, they think less of me. But it wasn't her saying, even though she maybe could have said it like, can I help you? Or how can we help you? But it wasn't what she said. It was what I thought about what she said that was making me feel bad. And here's the thing is the good news is that it is my thoughts. So I could think she just wants me to be on time. She wants me to know that they value time. And then I can act from a different way rather than getting defensive. So here's an example. You have a coworker who's critical of everything you do. She finds nothing to compliment or even recognize anything you do well. You think she's a terrible person. What is her problem? Result, you feel terrible. Enlightened example, your critical coworker, same thing, doesn't change. You think she must really have something going on. I can't imagine how she must feel. And then you're curious, maybe you're even compassionate. You let her actions be about her because they are. You're able to act more open and you want to find out about her life and you might even find a way to help her. So realizing that when someone is acting out, it's so much telling you that something's going on with them. So trying to find a way to help them. So now I have time for questions and I'm going to turn off my recorded so that we can go through any kind of coaching that you want, anything specific that's going on in your practice and you're having to deal with. I don't want you to feel like it's recorded on YouTube and everyone's going to hear you. So I'm going to just turn it on and then we'll, after the questions and the coaching, then we'll just go through if you want to work with me, what that would look like. And that's it. Thank you so much. All right. So for those of you who are joining us again on the recording, I just wanted you to know how you can work with me. So there's two ways right now. So the thing that I recommend the most is the 12 months. And it's not just because I get you for a whole year. That's amazing. It is documented research that it takes 12 months to make a significant change because if we want to get results that are different, then we need to change our thoughts. So if there's nothing else you've learned, I hope you figured that out, that the results in your life are due to the thoughts, and the thoughts are there for a reason. It's not like we just beat ourselves up. There's a reason that we're having the thoughts that we do. And so it's being able to understand those thoughts and question those and figure out what beliefs they're coming from. And that all takes time. And it also is so easily fall back into old patterns just again and again. And it's having someone help you have self-compassion as you fall back into that pattern and help you recognize it and then help you figure out how to unwind that. So that does take time. And so I've started out my coaching practice with like a 10-week program. And that was great. We got results, but lasting results really take time. So we've gone to this year and I've seen great things with it. So there's lots of options we can do. You can get a discount with a payment or 12 payments, 24 payments. I try to make it so that it's affordable for anyone. And then there also is a punch pass. So because I am an active life coach, which means I coach women and I'm probably half and half. We do Zoom calls or we do like Bluetooth. So when you're out on a walk or you are running or something like that, and I'm in your ear. So we do that. Coaching follows up with the email so that I kind of review with you and you can see what we talked about. So anyway, so we have Punch Pass 12 for the price of 10. So that's 12 coaching sessions. You can use that. It doesn't ever expire. You can use it as frequently as you want. So I would love to work with you. If any of this stuff like resonates with you, or if you think that it would be helpful for you or someone that I would love to work with you or any of your friends. Thank you so much for joining me tonight. I'm glad the power didn't go out, and I hope you all have a good rest of your week, wherever that may be. And I'm going to figure out how to stop my recording. There we go, right here. Good night.